So in parallel to the molecular profiling efforts that we have discussed already, looking at the genetics and epigenetics of tumors, we're searching for ways to use non-invasive biomarkers such as imaging to, again, better select patients for tailored treatments. So we've opened a study looking at 18F-clofarabine, which is a PET scan radiotracer that allows us to measure the activity within a tumor of deoxycytidine kinase, an enzyme that is important for the activity of a number of chemotherapy drugs, specifically cytidine analogs like gemcitabine, 5-FU, cytarabine. And so what we hope in this pilot study looking at this PET radiotracer is that we'll find that it has the dual capability of both identifying anatomically the location of a tumor, as imaging studies and PET scans have been used for a long time in oncology, but in addition, will give us information about the biologic properties of a particular patient's cancer with respect to its ability to metabolize chemotherapies. So by knowing this, again, we would be able to both stage a tumor and understand a little bit more about its behavior to help us, as I've said before, pick the right treatment for that patient. So, for example, a patient who has low deoxycytidine kinase may be better off with a targeted therapy and avoiding toxic chemotherapies or chemotherapies that are less likely to work for that individual's tumor. On the other hand, a patient has high deoxycytidine kinase may be more susceptible to a particular chemotherapy. And so the goal, even though we're not quite there yet, is one day to be able to use imaging and molecular profiling to select first-line and second-line therapies in a more rational and patient-tailored way so that we can more effectively treat a patient's cancer, reduce toxicity associated with the treatments for that cancer, and ultimately increase both the efficacy of our treatments and a patient's quality of life.